high cholesterol is linked to things like heart attacks and strokes. So the higher your cholesterol is, the more likely you are to have those bad things happen to you. And the lower your cholesterol is, the less likely those things are to happen to you. And we know that from studying thousands and thousands and thousands of people. It depends on what kind of risk profile you have. So for instance, say a 45-year-old woman with no other risk factors, her cholesterol goal should be different than, say, a 60-year-old man who has diabetes, high blood pressure, and already has a heart attack. The more risk a person has of an event like a heart attack or stroke, the lower their cholesterol should be. Our goals for therapy really depend on what a person's risk factors are. When you get a cholesterol panel back, there's a bunch of different numbers on that panel. The first number you look at is the total cholesterol, and that's just a measure of your overall cholesterol number. And normal for that is generally considered less than 200. Then you look at a number called the LDL, which we often call that the bad cholesterol, and that's probably the number that we pay most attention to. And that's the number that we look at when we talk about our goal for how low your cholesterol be. For instance, somebody who has had a heart attack, say, and maybe has high blood pressure, then we would try to get their LDL, or their bad cholesterol, down below 70. For somebody who has diabetes, their goal LDL should be less than 100. For somebody who's pretty healthy but maybe has one or two risk factors like high blood pressure or a family history of heart attacks, then it's suggested that their goal LDL should be less than 130. So the LDL is kind of the number that we look at probably the most. Then we look at the number HDL, and that's usually called the good cholesterol. With the HDL, the higher the better. The best way to raise somebody's HDL is with the things we talked about, like diet and exercise. And usually in a man, we like to see an HDL above 40, and we like to see in a woman an HDL above 50. And then you'll also see on your cholesterol panel a number called the triglycerides, and that's just a measure of the amount of fat in your bloodstream. And we use that as more of an indicator that there might be something else going on, like diabetes or high blood pressure, but we really haven't been able to define really specific goals for how low your triglycerides should be. Your cholesterol is affected by two things. It's affected by your diet, in other words, what you eat. It's also affected by your genetics. So there's some of your cholesterol that you can control, and there's some of your cholesterol that you can't control. You can affect your cholesterol by what you eat to some degree. Sometimes, especially for people who have really high cholesterol or who have really low cholesterol goals because of what their risks are, it's difficult for them to get their cholesterol down low enough by just changing their diet. But some of the things that patients can do to change their cholesterol is changing a little bit of the composition of what they eat. Less animal fats like red meats and butter and lard and stuff like that, and more plant-based fats like olive oil and avocados and nuts. Those types of fats are much better for a person than animal-based fats. And then a much higher fiber diet with things like fresh fruits and vegetables, and then lean meats from animal sources like chicken and fish and turkey, things like that. And then your exercise habits are also very important in lowering your cholesterol, but especially in raising the good cholesterol. Exercise, regular aerobic exercise, is the best thing to do to change that. There's a lot of medicines that have been used to treat high cholesterol, and there's a lot of things that you can get over the counter that have been used to treat high cholesterol. Things that you can get over the counter like fish oil and omega fatty acids. The most common class of medicines that are used to treat cholesterol are a group of medicines called the statins. Those types of medicines have been around for a long time, and because of that, there are medicines that are available in inexpensive generic formulations, and there are also newer ones of those that are, more expensive. The different medicines vary in their potency or in their ability to lower cholesterol. They're good medicines. We use the statins most, and they've been studied a lot, and they've been very conclusively shown to prevent heart attacks and strokes in people who are at risk for those things and who have high cholesterol. There's a lot of really good sources of information about high cholesterol. I always refer patients to the internet. At St. Alphonsus' website, it's stalphonsus.org, there's a health encyclopedia that has a lot of really good information about high cholesterol and how to treat it and what to do about it. And then, of course, the primary care physicians at St. Alphonsus Medical Group are available for these kind of discussions all the time. At the Meridian Health Plaza, we're taking new patients, and this is one of the things that I, as a family physician, most commonly do, is help people with their high cholesterol and their blood pressure, and really try to help people lower their risk of heart attacks and strokes.